significant changes to our public health directions. We are continuing to ask anyone in the priority groups, including residential aged care, healthcare workers, teachers, early childhood workers and Year 12 students to take advantage of the priority that you have to get vaccinated and to make those bookings as soon as possible. Now, in planning for the months ahead, I want to provide some further information for the community on that work and where we are going next. In the simplest possible terms, the next 8 weeks are a race to get as many people fully vaccinated as quickly as possible. As our vaccination rates increase, it is the government's intention to make gradual steps forward to manage our current outbreak. So we will be able to ease public health restrictions as our vaccination rate increases. The clear advice is that we will need to maintain many public health measures for the weeks ahead. We will outline the next steps on Tuesday of next week. I want to assure everyone that the path we will take will be informed by the health advice. Our approach will support a gradual and safe reopening that supports people back into work. Details on Tuesday of next week. In summary, for those who've joined late, we recorded 15 new cases, 13 of them linked, 5 in quarantine for their entire infectious period, at least 8 infectious in the community for some time, 2 still under investigation, 9 people hospitalised and 2 in intensive care, 1 at the Calvary Intensive Care Unit. And we thank the wonderful staff at the Calvary Intensive Care Unit for the support and care that they are providing that person. I'll now invite Deputy Chief Health Officer Dr Johnston to provide some further information on cases and epidemiology, and then Minister Stephen Smith will provide some further updates on changes to the Check-in CBR app, and then we'll take questions. Thank you very much.
Good morning. I'm Dr Vanessa Johnston, the Deputy Chief Health Officer of the ACT. As the Chief Minister has just said, since our update yesterday, the ACT has recorded 15 new COVID-19 cases. Our total for this outbreak now stands at 439. A total of 212 of our cases for this outbreak have now recovered. This leaves 227 active cases. Of the new cases today that I can confirm, out of the 15, 13 can be linked to known cases or ongoing clusters. 2 remain under early investigation. Out of those 13, we know that 8 are household contacts. Out of the total 15, 5 were in quarantine during their whole infectious period and therefore no risk to the community. Out of the remaining 10, 8 spent some time in the community for at least part of their infectious period, and 2 remain under assessment as to time spent in community at this stage. As of 8 p.m. last night, we had 9 people in our hospitals. 2 of these were in ICU and 1 required ventilation. It's my understanding that the male in his 20s that was ventilated last night no longer requires ventilation, which is great news. Of these 9, 5 are unvaccinated, 3 have received 1 dose, and for 1 person their vaccination status is unknown. We now have just over 1,500 self-identified close contacts and over 340 active exposure locations. So in terms of the broader analysis of the outbreak, there continues to be very little change in the age breakdown. So as I said yesterday, the majority, 55% of our cases are aged 18 to 44. That's down 1% from yesterday, and 28% of our cases are in people aged 0 to 17 years, and that's down 1% as well. We have no additional public sites of transmission today. However, we have one new case that has been linked to Bright Bees. That's a household contact. One new case for Bid Food Canberra. 3 new cases for Busy Bees Childcare Centre. And 3 previous cases that were under investigation as to their source have now been linked to Ainslie Village as part of our surveillance testing program. So I want to talk a little bit about Are You OK Day that we're celebrating today, or that we're marking today. This is a day to raise awareness about mental health, promote connectedness, and this is so very important, particularly now with the challenges that we face with this COVID-19 outbreak in the ACT. As we've mentioned previously, being in quarantine is hard, being in isolation is hard, and just being at stay-at-home restrictions is hard. It's important to remember that it's okay to find these experiences challenging. It is okay to not be okay at this point in time, and to reach out for support. Please reach out to friends, to family, to the many support services that are on offer if you are struggling and you need support at this time. Please keep on supporting each other, something the Canberra community continues to do so well and has been remarkable at over the last 18-month period. Finally, my shout out today is to ACT Health's Digital Solutions Division. This team are the architects and developers of the Check in Canberra app, which has been used in the ACT for a year today. The app is such an important part of our response to COVID-19 in the ACT. This team has literally worked day and night and continue to update and provide new features for the ACT community. Congratulations to the team and happy first birthday to Check in Canberra. Thank you.
Good afternoon. Well, as Vanessa mentioned, today marks the first anniversary of the Check in Canberra app. Happy birthday, Check in Canberra. And what a success it has been. Over the last year, the app has had a tremendous uptake, with more than 950,000 downloads, 47 million check-ins at nearly 20,000 registered ACT businesses and venues. The technology has also been taken up in 3 other jurisdictions across Australia, with Queensland, Tasmania and the Northern Territory all using our check-in technology developed right here by our ACT Health Digital Services Division. Today, we're releasing new features for the app in response to feedback from Canberrans. The first thing I want to talk about is a new free Check in Canberra card that will provide another option for Canberrans who don't have a smartphone or are unable to download the app because their phone is too old and doesn't have this technology. While venues have been able to check in customers through the business profile for some time, we know that this hasn't been an ideal solution. So each new Check in Canberra card will have its own unique QR code, and customers will simply present it to be scanned using the Check in Canberra business profile. Check-in information that's collected this way will be stored directly with ACT Health in the same way as data that is collected through the app, making it even easier for people, for businesses and for our contact tracers to work together to keep Canberra safe from the spread of COVID-19. The consumer's name and phone number will also be recorded on the Check in Canberra card, so if a business isn't able to use the QR code, they can enter the person's details directly from the card in the same way that they have been doing with the business profile to date. To apply for a free Check-in Canberra card or for more information, simply go to the ACT's COVID-19 website, www.covid19.act.gov.au, or call the ACT Health Digital Solutions Support Team on 5124 5000. We're also adding a new exposure alert feature to the Check-in Canberra app. People have been asking about this. Will the app be able to notify them if they've been at an exposure location? And from today, the answer is yes. Users will receive an SMS or push notifications, a message on the home screen of the app, and coloured identifiers in their check-in history if they have been at an identified exposure location. The check-in history will identify whether sites are close or casual contact so that people can take appropriate action to quarantine and get a COVID-19 test or monitor for symptoms if they need to. These alerts will again make it easier for Canberrans to act quickly if they have been to an exposure site and help to limit the spread of the virus within the community. It's still very important to check the COVID-19 website for all exposure locations in the ACT as well, though. You may, for example, have forgotten to check in, or the timing might not quite be right. I want to also give a shout out to the digital team in ACT Health who have worked hard throughout the pandemic and added a range of new features to Check-in Canberra over the last 12 months. But just to remind everyone, you only get these new features if your app is updated. So today is a good opportunity to check that your Check-in Canberra app is up to date. Before I hand back to the Chief Minister, I'd just like to highlight that in recent days there have been people who have been symptomatic for some days before presenting to the emergency department. So people who are turning up sick to our emergency departments, who have COVID-19, who've been unwell for some days and didn't go and get tested. And some have subsequently tested positive for COVID-19 and have been admitted for inpatient care at hospital. So this is another reminder to please get tested as soon as you develop any symptoms of COVID-19, because we know with this disease you may in fact become quite unwell quite quickly. This is a highly variable disease that can be mild or can be quite severe, and that can happen quite fast. So the earlier someone knows that you're a case, we can support you, protect the community, make sure that you get the care that you need. There are plans in place to ensure that COVID-19 suspected and positive patients are safely managed through the emergency department, and our staff are well trained in infection prevention and control requirements. But it is really important for your own health and well-being that if you're symptomatic, you go and get tested so that the right supports can be put in place if you are, unfortunately, one of those people who has been in contact with this very tricky coronavirus. With that, I'll hand back to the Chief Minister for questions.
Thanks, Rachel. Questions? Harry?
Chief Minister, the New South Wales Government has today outlined its roadmap out of lockdown or the tougher of restrictions. You say on Tuesday you'll outline your plan. When you're formulating this plan, how closely will you look at the New South Wales plan and how dependent on that plan will the ACTs be?
It's a factor, but not the predominant factor. So local conditions, local vaccination rates, local epidemiology will be the major driving force behind our next steps and where we will go over the coming months. But what's happening in surrounding New South Wales is an input into risk factor and clearly also provides an important guidance on really where the velocity of the double dose vaccination path that they follow will give some indication, I suspect, of our trajectory, although we are mapping that very closely in that they are ahead of us at the moment on first doses, but behind us quite significantly on fully vaccinated. So, and they've got different dosing intervals for their second doses because they've been prioritising first dose. So one of the factors that we're looking at is when they might reach some of those thresholds.
Yass Valley looks like one of the LGAs that will be very soon coming out of lockdown. Is that concerning that there may be more freedom of movement for people in the region surrounding the ACT? Will people from that region have more freedom of movement into the ACT?
So, as I understand the New South Wales changes, they wouldn't be permitting travel from non-locked down local government areas into locked down areas. So I think the main implication of that is a little bit more internal movement within the local government area rather than between local government areas. I mean, the word of caution clearly would be that there's virus circulating in surrounding local government areas and in the ACT. So if you're watching this from Yass, then I wouldn't be advising moving too far out of your local government area. In fact, I wouldn't be advising doing that at all.
Earlier in the week, you expressed some concerns about using QR codes to show your vaccination status. Have you now told the Commonwealth that we're not going to be using the Check in Canberra app for that purpose? Is that also going to be true of the other jurisdictions using the same technology on their apps? What will we use instead, and why does the Commonwealth have a different view on the use of QR codes?
Okay, so 4 questions in that. If I forget one, please remind me to come back and answer that. So when we began the discussion on this matter in National Cabinet several meetings ago, I flagged both the technical issues and the range of policy and broader philosophical issues and challenges that would be there. The decisions in relation to whether you could download the Commonwealth verified vaccination certificate from MyGov or Medicare in a voluntary way and just have it on your Check in Canberra app are yet to be finalised by the ACT government. That has implications in terms of the source code for the app that is being, the architecture of which has been utilised by Queensland, Tasmania and the Northern Territory, but reskinned to be Check in Tassie or Check in NT or Check in QLD. So they've done some redesign of the public facing element, but the actual functionality of the app is drawn from the ACT work. So we have again had the initial discussion in National Cabinet, but with no formal paper or decision-making process, just simply an information sharing exercise at 2 National Cabinet meetings. The detail of the work is being undertaken by digital services ministers that is, I understand, what they're calling a design sprint. And they're doing that in 2 streams effectively with those jurisdictions that have the identity verification state-based apps, New South Wales, Victoria and South Australia from memory, and then the rest of the country that have a different set of arrangements. Now, to the substantive public policy issue in relation to the use of this. In the ACT context, this is a solution looking for a problem. The argument for it is that it would drive up vaccination rates. We have no issue in the ACT with our vaccination rates. They are nation leading in every age cohort. The only thing that is holding back this community from getting to 95% vaccination is available vaccine supply. So we're going to get there based on first doses and based on bookings. So we don't need the QR code and the vaccine passport as a way to drive up vaccination rates. That's not an issue in the ACT. I acknowledge it might be an issue in some other jurisdictions, and that might be why they would pursue it. The second issue that is put forward in the argument in favour of doing this is that it would enable some freedoms to be given to fully vaccinated people at certain thresholds ahead of everyone else. Now, again, in the ACT context, when we reach 70% double dose fully vaccinated, we will have, on the current trajectory, have put first doses will be at 95%. The tail end of our vaccination program will entirely be second doses. Yesterday, for example, it was 60% first doses, 40% second doses. As we march week on week towards the end of the vaccination program, that will shift to being 90-95% second doses. What this means in raw percentage terms, given that the difference between 70% and 80% in the ACT is about 37,000 vaccinations, is at 8,000 vaccinations a day, 5 days of vaccinating. So why would we go through the entire rigmarole of putting in place such a complex set of systems with fraud risks, with compliance nightmare associated with it, for the sake of 5 days of extra vaccinating? And then when you think about that again, 5 more days, you go from 80 to 90. So this is a solution looking for a problem in the ACT. That's just the practical reality of it. Then you get to the whole range of philosophical questions about whether you would, what benefits you would bestow upon vaccinated people, particularly when the issue in the ACT is not that people aren't wanting to get vaccinated, it's that we just don't have enough Fisa in the city at the moment, although it's coming. Then we then get to, I guess, a range of human rights issues and questions about, would you be denying access to essential services for people who are unvaccinated? No, you would not. As a fundamental principle of this jurisdiction, we're not going to say, no, you can't come to hospital or access healthcare services because you're not vaccinated. You can't, we're not going to put in place a range of things that exclude people who, for a variety of reasons, some for medical reasons, others because they wouldn't have even had the opportunity to get vaccinated. We're just not going to go down that path. I think the last thing to observe is just how difficult this is going to be in terms of compliance. Whose responsibility is it going to be to check that it's only vaccinated people in a particular setting? Is that going to fall on the business? If so, okay, maybe some businesses might want to do that, but let there be no expectation that there's then going to be another layer of checking from ACT government on the compliance of the businesses checking the compliance of their own program for the sake of 5 or 10 days of difference between 70 and 90%. Why would you do it? It just seems crazy. But I accept that other jurisdictions might have a different set of rationale, or might need to address the let's get vaccinated, this is an incentive element, but it's just not the case in the ACT. Does that answer all 4 questions?
Yes, I think so.
Excellent, thank you. Next up.
Chief, we're still getting moderate numbers of people infectious in the community. In your opinion, is this still people going to the shops before getting a test, or I guess are Canberrans doing something wrong?
It's a combination of factors. There's still a few in that context, but much less since we've made a really big point of it. A lot of the time it's people who don't know that you seemingly develop symptoms sort of 4 or 5 days after you've been infectious. It can be that period, and so we still get a proportion of people who are unknowingly infectious in the community. They start to feel quite sick, but they've been 3 or 4 days often where they're potentially exposed. This is, and potentially infecting others, which is why the face mask wearing, the social distancing, the hand hygiene, and the other public health measures are so important. That's the layer of protection that the community has. If we didn't have those in place, then we would be where Sydney is. And so one of the reasons why we don't see hundreds of cases every day in Canberra, why we don't have dozens of people in intensive care and hundreds of people in hospital, is because of the measures that we've got in place.
Chief Minister, the real estate industry is waiting on an application for a return to one-on-one inspections in properties. Can you provide some advice on that, whether that's now going to be approved?
Sure, yeah. So they've obviously, in our engagement with industry, we've been looking at things like that have been brought forward as priorities for particular industry sectors, and that's part of the consideration that we're having now and over the weekend that will inform the decisions the Chief Health Officer will make following all of that engagement that we'll announce on Tuesday. Yep.
Chief Minister, the World Health Organisation has called for a moratorium on booster shots for COVID vaccines for wealthy nations until 2022. Will it be appropriate for Canberra to immediately launch into a booster shot program, as you've indicated previously?
Well, I suspect that there's not a massive difference in terms of what immediately launching into, given I think we'll still be undertaking first and second dose vaccination for some people in December. I imagine we probably won't be massively busy with vaccination between Christmas and New Year, and so it may be that once things come back after the usual summer holiday shutdown, that depending, of course, on Commonwealth government supply lines and decisions that would be informed by ATAGI and AHPPC, that you might need to begin to have booster shots for those who were in the very first round of vaccination, the Phase 1A people who would have got their first shots in March and April, I think. So that would be sort of the time frame. So I don't think there's a massive difference. I appreciate the point that the World Health Organisation is making. It's not really a policy decision for the ACT so much as a policy decision for Australia.
The Pfizer allocations between the states have drawn a lot of attention in recent days.
They have, yes.
Can you confirm what percentage of the Pfizer allocation for the ACT will continue to be used for surrounding New South Wales residents?
It'll be in the ballpark of 10 to 12%. I think that's pretty consistent with where we have been. We've obviously shifted some of the delivery of this in the context of the lockdown and travel arrangements, where we've, rather than had people coming into the ACT, we've sent the doses back into New South Wales. Look, we're getting an updated Horizons document with new supply lines and arrangements, so we'll look at that and be able to give you a more definitive answer. But I wouldn't anticipate a radical shift up or down, but there might be some movement.
And given the number of cases who have been active in the community for some time during their infectious period, could you see the ACT needing to adjust or tighten restrictions in the short term while vaccination rates catch up?
Look, that's something that we would seek advice on from the Chief Health Officer based on the sort of detailed epidemiology. There are a number of factors that underpin that decision making. The transmission potential in the community more broadly, the effective reproduction rate of the virus, based on rolling 7-day averages, number of active cases in the community, and I note that although we've had 15 new ones today, we've had more people recover, so the number of active cases has actually been dropping in recent times. It peaked at somewhere near 260. Well, I hope it has peaked at somewhere near 260 and is down into the 220s today. So that's another factor. The risk profile of those individuals, where were they infectious in the community? How long for? Were they people who were wearing masks? How many people did they come into contact with? That's another factor that goes into the consideration. And then the totality of the number of infectious days in the community. So how many people, how many days, where were they? all drives, they're all inputs into the Chief Health Officer's sort of detailed examination of the epidemiology of the outbreak that then advises government.
Chief Minister, it's your 28th or 29th press conference in a row. And on,
Someone's counting. Yeah, it's a lot. Yes.
Are you okay, Day? Are you okay?
Well, look, this is a challenging time for everyone. There's a wide range of issues that we need to consider. I am okay. Thank you very much for asking. But myself, my cabinet colleagues, everyone in government is working incredibly hard at the moment across a multiple range of issues. But I think the observation I would make is that those who are working the hardest and doing the most to help our community are our frontline healthcare workers, those who are tending to people and supporting people in intensive care and in hospital, those who are providing care for people at home, those who are doing the vaccinating, the testing. There's an extraordinary effort across Canberra Health Services, Calvary Public Hospital, Capital Pathology, ACT Health, and then the work that's occurring within the Health Directorate and the wonderful support that's being provided across ACT government. Not to mention all of the interface with the Commonwealth, all of the work that National Cabinet is undertaking. You've got simultaneous streams of really detailed policy work that covers everything from human rights, through to on-the-ground health responses. It's an extraordinary effort. But to cut a long story short, I feel very well supported by the entire ACT government.
Yesterday, we heard that there was apparent delays in meetings between the Commonwealth and Fisa about securing supplies for Australia. What did you make of those reports? Were they frustrating to read as a territory leader trying to oversee a vaccination rollout?
Well, given so much hinges on vaccinating people as quickly as possible, and this is the business that every state and territory is in. We're the ones on the ground doing most of the heavy lifting here. In partnership with GPs and pharmacists and nurse practitioners. That it's frustrating to learn that we might have been able to get more vaccine more quickly, and we wouldn't be in the situation we're in at the moment had that been the case. However, it is what it is. And you can really only play the hand you're dealt. And so that's why our focus now is just to vaccinate as many people as possible, as quickly as possible. And Canberrans have been fantastic in coming forward. This is the pathway out of where we are now to where we want to be, which is a safe and happy Christmas and summer holiday period for everyone. I know that's what people are looking forward to. And to perhaps pivot back to Emma's question, I am too.
Chief Minister, just to clarify, does this mean we've given up on the whole lot concept of getting back to zero cases, and now our strategy is based on a correlation with our vaccination rates?
Wouldn't quite extrapolate that. I would suggest that we've got three tools to get our case numbers down as low as possible. Vaccination is an increasingly strong part of the toolkit, and it is having a big impact on bending the curve. But TTIQ and the public health measures also contribute. The public health measures, particularly in reducing the risk of one case, sparking 5, sparking 25, sparking 125. So that's still part of it. But as I've said repeatedly, there's controlling this outbreak, and then there's the challenges that the weeks ahead will have. We will all be in a better position the more of us who are vaccinated. That just reduces the transmission potential of the virus, reduces the number of people who will get severe disease, takes pressure off the health system, and it just generally leads to a healthier community, which is what we want.
And will we have any form of vaccine passport?
Well, there's
And
one
will
of
it be used?
there's one of our, I've got one in my Apple Wallet at the moment, to the extent that you can download your vaccination status. Well, the ACT, I don't think any state government is sort of doing that. They're tapping into the federal Australian Immunisation Register and linking it to a check-in app. But I don't think there's I'm not aware anyway of any state proposing to effectively set themselves up as another country within Australia. The vaccination passport in those terms is definitely applicable to international travel, but I've heard others want to describe, the internal arrangement more as a health pass or a health check rather than a vaccination passport. Passports really does imply going from one country to another. And as much as Australia has at times felt like 8 different countries at various points over this pandemic, I'm not comfortable with that language.
So would the ACT have a health pass developed with the Human Rights Commission to make sure it's not discriminatory?
Well, not that I think it's unlikely to be that would apply to ACT government buildings. We have a requirement around aged care workers, and so we may consider it in particular workplace settings. But is there going to be an ACT government decree in relation to having a vaccination certificate? No, it's getting vaccinated is voluntary. Downloading a certificate off the Medicare app is voluntary. Putting it in in your Apple Wallet or whatever the equivalent thing is on the Android system is voluntary.
That is where we'll leave ACT Chief Minister Andrew Barr with his update on the COVID situation here in the capital. 15 new cases today, 13 of them linked, 8 infectious, while in the community 9 people remaining in hospital. Let's bring in our reporter Holly Tregenza, who's been monitoring the COVID situation here in the ACT. G'day, Holly. Some announcements there from Andrew Barr about how willing he is to start to ease restrictions, saying he'll set out a gradual plan to ease restrictions from next week, but also noting a bit of a reluctance to jump in line with what we've heard from the New South Wales government as well.
Yeah, that's exactly right. So Andrew Barr, we've just heard here, is going to announce our plan, or I guess our way out of lockdown on Tuesday. But he hasn't committed yet that the lockdown will end when it's scheduled to on September 17, which is next Friday. He said that we will be taking small steps forward, and those small steps will be in line with our vaccination program. The more vaccinated we become as a community, the more freedoms we will have. And as you said, he also made some comments about the vaccine passport. He said that the Canberrans don't need more motivation to get vaccinated. He's happy with the way vaccinations are right now, and he's unwilling to fall into line with other states and territories who are saying that people who are vaccinated will have more freedoms. He has also made comments about concerns that the ACT is a human rights jurisdiction, which means that we have less ability to make these sort of changes to
and our community partners to continue to support residents to quarantine.
The ACT continues to report a significant number of new cases having been active for at least some time in the community. Is there anything more that can be done from a public health point of view to prevent that, speeding up contact tracing, improving quarantine arrangements, or is this just the reality of containing or attempting to contain Delta?
I think it's the latter. So, as the Chief has spoken to, that that time spent in community includes a range of different circumstances. Some of this goes to, our unlinked cases, and so that people don't know, and we don't know, that there are actually close contacts that are incubating the disease in community. So they're unknowingly there. We're very conservative in that we count people that are essential workers that need to go to work but actually maintain PPE as not being in quarantine, but actually in reality they pose very little risk. So we're certainly hitting all of our national contact tracing metrics and thresholds. So I don't think it's so much a function of more resourcing or people put to contact tracing. We're doing really well there. It's just a feature of Delta, and the fact that we're quite conservative in how we how we measure that metric.
The New South Wales ref, I understand, has dropped below 1 for the first time since their outbreak started, so it's starting to look kind of peakish. In terms of that combined with our kind of relatively under 20s-ish numbers, how much are you buoyed by that in terms of, I guess, our strategy in moving forward?
Yeah, I think that's. I think it's really positive. I think the epidemic situational report's just come through, so I've just had a quick look at it in my email before I came on. So we're still doing really well. I think we're about 0.9 in our RF, and our transmission potential is around 0.8. So that's still looking really good. I think I'm really happy that our numbers seem to be stabilising. Our averages seem to be stabilising. You know, I think it's good news. I think, you know, we have reason to be optimistic that we're not going to spiral out of control. But at the same time, we have to be really cognizant that when we do start to ease out of lockdown, that it won't be a snapback. We just can't do that. We know that's a recipe for a quickly evolving outbreak with the vaccination rates that we have at the moment.
About half the cases have recovered. What does that tell us about the recovery rate, and what does it tell us about Delta and perhaps about ACT, the health of ACT people?
I think so. There are sort of set guidelines in terms of how we determine when someone's recovered from the national guidelines, and it's how many days they've been symptom-free. And so you need to be symptom-free for 72 hours, and you need to be 14 days after your first onset of symptoms. So I think from the perspective of Delta, I think the evidence is still out in terms of whether this is a variant that's associated with increased severity of disease. There is some data that suggests there is, and there's some data that suggests there isn't. I think we are blessed in the ACT to have, on average, a very healthy population and an extraordinarily good health system. We've also got a great care at home package that's been run out of Canberra Health Services for each of our cases. So they're all managed and triaged according to their health risks and their pre-existing comorbidities about the level of healthcare and input by telehealth they might need. So, you know, I think we're tracking really well. I think I'm really buoyed every day that I see more and more people coming out of isolation and recovered. I think it's going to be internationally, we still need more accumulation of evidence to suggest or to investigate that association between the potential for Delta to cause more severe outcomes or even longer term outcomes, so that we're still a long way to fully understanding that.
Some questions for the Minister, if we can.
Absolutely.
Minister, with the Check in Canberra app, now notifications are no doubt going to be helpful, but they're hardly a revolutionary change in the app. Why has it taken 12 months to implement this change?
Well, I think we've been listening to feedback from people. So the purpose of the app has been to provide information to our fantastic contact tracers so that they could make direct contact with people who were potentially affected by having been at an exposure location or having come into contact with someone who subsequently tested positive for COVID-19. Clearly, we've seen through this outbreak, and I think we've got to constantly remind ourselves how relatively new the Delta strain is and how much that's changed the whole way that COVID-19 needs to be managed and the speed and size of the outbreaks that we're seeing. So it had been, the purpose of the app was to provide information for our contact tracing team so that they could make direct contact with people who were affected by a newly identified case. We've clearly seen a significant number of exposure sites identified through this outbreak, a significant number of large exposure sites identified. And that's meant that our team has, you know, it's been difficult to make direct contact with all of those people who might have been at those exposure sites. So we've been encouraging people to look at the exposure sites on the website. We still encourage people to do that. But we've also heard the feedback from people that they would like to be directly notified through the app, rather than just the SMS from ACT Health and looking at the exposure sites. So that's the change that we've made to address that feedback from people. I think it is really important to say two things about that. Firstly, this is a prospective change, so they're not going to go back and identify any previous exposure sites that have been notified and put those into people's check-in history. So it will be from today forward as new exposure sites are identified. And also to recognise that the process will be that those sites will be identified and pushed out to people's apps at the same time that they go up on our public exposure site list. So it's not an automatic matching of one person's app who might have been identified as a case with other people's apps. It still has to go through that case investigation process, being the exposure sites being confirmed by our fantastic contact tracers, being cleared as exposure locations, and then that information being pushed out to people.
Has the lack of that notification function then really impacted the response in this outbreak?
Look, I don't know that it has. I think people have very quickly got used to the idea that they need to check the exposure locations on the ACT COVID-19 website on a regular basis. They're also obviously read out every morning on ABC radio, and other channels I'm sure have been promoting the exposure locations and the need for people to check those. And there has been direct contact through SMS with those people who are identified at having been at those exposure locations. So this additional functionality is something that people have said that they want. It's very quick and easy for people to identify those exposure locations. So I think it will help, but I don't think our test, trace, isolate and quarantine response has been particularly affected by not having this, because our team has done such an incredible job on staying on top of that so far.
As part of these changes, will some of the processes be more automated for those contacting of people, or will it still require somebody to press the button or tick the box?
Yeah, so it still will require that investigation by the case investigation team to go through the cases, check-in Canberra history and everything else that they've been told through their interviews with that case to identify what they think the actual exposure location and timeframes are, and then those will be pushed out. So that will then be an automated manual process. At the same time they go up on the website, they will be pushed out to everybody whose Check-in Canberra app tells them that they've been at that place at that particular time. But there will be an intermediary step of that case investigation to identify the locations and times that really should be identified. And we've talked before about the reason for that is the team needs to work out, is it a close contact exposure location, is it a casual contact exposure location, or is it a monitor for symptoms location?
It sounds like this may change now, but the text messages that people have received previously from ACT Health hasn't included where the actual exposure location they were is. What was the reason for that?
Oh, look, I can't tell you what the reason for that is. I think it's because of the number of exposure locations and the number of text messages that are going out, that the simplest process was to just alert people that they had been at they'd been identified as having potentially been at an exposure location, and then asking them to go and have a look at the website and complete the declaration form accordingly. So this addition to the Check-in Canberra app will make that easier for them. If they get that text message, they will then be able to see exactly which location or locations might have been involved.
We've heard for weeks about people seeing a delay between having been in an exposure location and then finally receiving that text message or notification. Have contact tracers had issues with contacting people?
Look, I think we have seen a very large number of cases, and we've talked about this before, that the case investigation team then needs to go back and interview those people to identify, of all the places that they have identified on their app where they've checked in, is it a close contact site, is it a casual contact site, is it a monitor for symptoms site, but also as the Chief Health Officer and Deputy Chief Health Officer have talked about, that people will remember places they've been where they haven't remembered to check in, or there is no check-in because it's not mandatorily required. So that that process can take some time. They re-interview people, and people will remember some days later, oh, actually, in between here and here, I actually stopped off at this other place, and then that will potentially become an exposure site. So it's unfortunately part of the case investigation process. They do that as quickly as they can, but there are some parts of it that they can't speed up, including people's memories.
But in many of these cases, the exposure location has been listed online, and then it's taken still a substantial amount of time for notifications to go out to people. So that's simply the human factor that's causing this issue.
Yeah, look, I think it's just a factor of the number of exposure locations and the number of people involved.
We've heard today that people are presenting to emergency departments potentially sometime after they've become symptomatic, and some have subsequently tested positive for COVID-19. Have you got any sense of the cause of that? Is it people concerned about testing positive, worried about losing work? Can you sort of provide some of the reasons why this might be happening?
Yeah, look, I think, Jasper, both of the things that you have identified, concern about what the implications might be of testing positive, concern about what that means not just for themselves, but also for their family who will have to go into quarantine, or other members of their household who have to go into quarantine, what that means about their family income. It's really important, I think, that we continue to get the message out to people, particularly those who are in insecure work, that there is financial support available, there is material support available to people if you test positive or if you have to go into quarantine, and there is healthcare support available. I think we need to remember there's a diversity of people in our community. Some people, for very good reason, are not comfortable accessing mainstream health services, and that is an inhibitor to them, and so they may not come forward until they're quite unwell. I guess what I want to do is reassure everybody in the community that health services are available to you, and we really need you to come forward for testing if you are the slightest bit unwell. We will be able to support cases, but people who test positive financially, with material support and with health support. And the earlier your COVID-19 is identified, the better the support we will be able to wrap around you.
The check-in card is welcome, probably better late than never, but is it a mistake from a policy point of view to assume that most or everyone has an up-to-date smartphone in these situations?
I think some months ago, we put in place and we set up a business profile through the Check-in Canberra app to ensure that those people who didn't have up-to-date smartphones, who weren't able to download the app, or for whatever other reason weren't actually able to use that technology, were still able to be checked in. You can either be checked in by a friend or family member that you are with who has a smartphone, and I know I've checked in other people at locations, or you can be checked in by the business through the business profile. So yes, it's great that we're announcing this now. I know that people had been calling for it. It really was about working through what the best technological solution for that would be, and a QR code seems obvious, but it's actually a different process for the business through their business profile to be scanning a QR code. So that just had to be all worked through, and then how that was going to feed back into the system. So that is then a different process again from people typing something into their business profile to check people in. So there's a bit of technology behind this. Great, thank you.
Chuck it on Dave's, I reckon, because no one rolls on mine. I don't think. Is that all right, Dave? I'm just going to quickly refill my card. I'll shoot some more cards to play out at the end of the cuts. All right. Just refeed my card, just looking at it.